Well, welcome back to Detox. I'm Dr. Caitlin, and this is video number 7, lucky number 7, of the 7-part video series on the specific 7 lymph nodes. That means that today is the last one in the series. I know. Except, because you're going to know exactly what to do and how to implement it. Now, today, this one is one of the ones that I get, here's the thing, I get a lot of compliments about a lot of things. Different people get like benefits from doing different things, but the knee is a big one. It is a huge one when it comes to lymphatic congestion and drainage. And so I'm going to definitely encourage you to stay and watch exactly how to do it. We'll talk about why the knee becomes problematic, what can cause problems with the knee, causing fluid retention to back up, all of those things. Now, as I mentioned in the other videos, if you've seen the other videos, great, make sure you do it in order. You got to do it from video 1 and work your way all the way to video 7. If this is the first video you're seeing, please go watch the other videos, 1 through 6, because I literally teach this in the order in which you should be performing it. And I'm teaching it one at a time because I want to make sure that you have enough time to actually like play around with it, work on it, feel good about it before adding another step. I don't know about you guys, but if I have too many steps when I'm first learning something, I get overwhelmed, I forget things, and then I just don't do them because I'm like, well, I don't remember everything, so there's no point in doing it. And that is the last thing that I want you guys to do. I want you to feel confident in what you're doing so that you do it, because I know that if you implement this, you're going to feel great. You're going to feel so much better. And here's the thing, even if you don't feel bad right now, when you start implementing lymphatic drainage, I have people all the time who are like, I feel better and I didn't even feel bad to begin with. And that's the beautiful part about your body removing that cellular metabolic waste that's just sitting there. Who doesn't want to feel better for taking a couple minutes a day? It's super simple. So let's dive in. You might be thinking, well, you know what? I don't think this one's important to me because I don't have any fluid retention. Like I don't have any swelling in my feet or my ankles. I don't have any swelling in my knees. I'm good. Maybe, except if you've ever had any type of knee surgery, whether it's cartilage, whether it's a lateral release, whether it's a knee replacement, whether it's any type of surgery around that knee, you're going to want to do this, because what happens is anytime we have surgery, we end up having and altering how our lymphatic system flows and drains. So the number of knee replacements, the number of like lateral releases, so like releasing the IT band or, ACL surgery, MCL surgery, meniscal surgery, cartilage cleanup, you name it, you're going to want to do this. Also, if you're somebody that wakes up in the morning and you feel stiff, especially in your lower body, it takes you a minute to get moving. You have achy, sore muscles, whether it's like in your quads, your hamstrings, your calf, your feet, if you get like plantar fasciitis, things like that, you're gonna want to implement this because again, waste products sitting there drives inflammation, and inflammation is going to cause tissue breakdown and cause that pain, that cramping, that discomfort, and joint inflammation. So arthritis is another thing that they're starting to look more into about, could arthritis be due to improper lymphatic fluid drainage? I wouldn't be surprised. So with that being said, with the knee, this one we are working behind the body. Everything else that I've taught you guys has been in front of the body so far and under the arm, but this one is behind the knee. So it's going to be behind the kneecap. And the hand position, so we're going to be doing the I love you, just like we did with like the cisterna chyli and things like that, or even the tonsils. So we're using our ring finger and our middle finger, and we're doing one side at a time. So just like with the armpits, we cannot do both sides at the same time. You'll get a better result doing one leg at a time. Now, what you're also going to do is these two fingers, the pads of your fingers, go behind your knee, and you're going to wrap your hands, and I'll show you, don't worry, around your knee. You want your fingers pointing like down your leg, and then when you pull up, you pull your fingers up just like this. So let me show you. You can see behind my knee. What we're gonna do is take the pads of my fingers, put them behind my knee, and then my hands wrap around my knee. The reason I wrap them around my knee is so that I can have better control and I'm not forcing. This is still very gentle. So hands around my kneecap, wrapping it around, and what I'm going to do is I'm going to pump up. You can see that my fingers are coming from below and just coming up. I'm not moving my whole hand. It's literally just this nice slow pumping motion, just like this. Now, when you do this, none of this should ever be painful. The cisterna chyli is the only one that can feel very uncomfortable at times, and it's because of the location of that node. So when we're doing this, if it's painful, if any of the nodes are painful, stop, look at your location, look at your pressure, how hard are you pushing, look at, where's the direction that you're moving in. The other thing is, if you have lots of swelling, it may be uncomfortable. It should not be sharp shooting pain though. Like never should there be sharp shooting pain when it comes to lymphatic drainage. The other thing is with lymphatic drainage, especially like in an area here, it's more stretch of the skin. We're not digging. So we're not trying to get in behind that knee and really like move things around. Not the goal. Think about like stretching the skin. If this is the skin and this is behind the knee, like if this is behind the knee, I'm just stretching the skin. You see, like that's really all I'm doing. That's all you got to do behind your knee. Now don't forget to do the other side. It's going to be the exact same thing. How about I just show you guys one more time for good measure. Hands, both sides, fingers wrap around, and I'm right in the bend. I'm like right in the bend of my knee. And what we're going to do is we're just going to pump up. You can see I'm not moving my whole hand. My hand is staying stationary. I'm literally just moving my fingers, but I like to have my hands down because it prevents me from being more aggressive with the fingers. When you have your hands cupping your knee, it tends to be a more gentle and a more focused lymphatic drainage routine ultimately. So what you want to do, open up the lymph nodes 1 through 6. Then we go to the knee. What you want to do at the very end. Actually, you know what? We're going to do a bonus video. We're going to do a bonus video. You're going to want to come back and see the next video because I'm going to do a bonus video and tell you how to wrap up your lymph nodes and why you need to do it. This is going to be a bonus video. That way I can keep these videos a little shorter for you too. How many times do you do this? Same thing, 10 to 50 times. Each side 10 to 50 times. The other thing is, ideally, you want to do it daily. When you're new to this, the more frequent and more consistent you are, the better the results you're going to get. Plain and simple. So don't be shy with it. Set an alarm, habit stack it. Figure out when the best time for you to do this is because there's no real best time. It's whatever works for you. I can't wait for you to implement these 7 into your routine and then come back for a bonus video. It just came to me right now. I'm going to do a bonus video about how you can wrap all of this up and why you need to do it. All right, guys, happy draining and thanks for being here.